Recognizing symptoms of hepatocellular cancer early. Silent threat or manageable risk. Hepatocellular carcinoma, liver cancer that develops mainly in people with cirrhosis or chronic hepatitis, often shows no symptoms until advanced stages. This video gives you the evidence-based knowledge to recognize warning signs early, understand who is most at risk, and know exactly when to seek medical attention through content that is professionally sourced by Saboor, consultant surgeon. Hepatocellular carcinoma, or HCC, is a primary tumor of the liver that typically develops in the setting of chronic liver disease, specifically in patients with cirrhosis due to alcohol use, chronic hepatitis B or C virus infections, or metabolic dysfunction-associated steatohepatitis. Understanding HCC symptoms matters personally because this is the third leading cause of cancer-related deaths worldwide, yet early detection dramatically changes outcomes. When tumors are detected at 2 centimeters or smaller, 5-year survival exceeds 70%. In Western countries, fewer than one-third of patients with cirrhosis undergo surveillance, which means many discover their cancer only when symptoms appear, and symptoms typically signal advanced disease. Before we dive deeper, let us establish what we are dealing with. HCC is frequently diagnosed late because early disease is asymptomatic, and this absence of symptoms in early stages creates a dangerous window where cancer progresses silently. Here is something that might surprise you. Most people with early hepatocellular carcinoma have absolutely no symptoms. The prognosis of patients with HCC remains poor, with a 5-year survival rate of 18% overall, largely because HCC is frequently diagnosed late in its course for 2 reasons: the absence of symptoms in patients with early disease, and the reluctance of some clinicians to provide surveillance for high-risk patients. Among patients with more advanced liver disease, symptoms and physical findings are often due to underlying cirrhosis rather than the tumor itself. This is why surveillance, regular monitoring with ultrasound every 6 months, is so critical for high-risk patients. The goal is to detect tumors when they are 2 centimeters or smaller, when the entire range of treatment options remains available. Previously stable patients with cirrhosis may suddenly develop features of liver decompensation, worsening liver function due to the extension of HCC into the hepatic or portal veins as the initial manifestation of the tumor. Variceal bleeding means bleeding from enlarged veins in the esophagus or stomach, which can cause vomiting blood or passing black, tarry stools. Ascites, fluid accumulation in the abdomen, causes abdominal swelling and discomfort. These signs can appear suddenly in someone whose cirrhosis was previously well controlled. But here is where it gets interesting. These symptoms may not mean the underlying cirrhosis is worsening on its own. They could signal that HCC has developed and is now invading blood vessels, specifically the portal vein or hepatic veins. Patients with advanced lesions may present with mild to moderate upper abdominal pain, weight loss, early satiety, feeling full after eating very little, or a palpable mass in the upper abdomen. These symptoms typically appear when the tumor has grown significantly. The median survival following diagnosis for patients presenting with symptoms ranges from approximately 6 to 20 months. Upper abdominal pain is usually dull and constant, located in the right upper quadrant where the liver sits. Unintentional weight loss. Losing more than 5% of your body weight over 6 months without trying is significant. Early satiety happens because the enlarged liver or tumor presses on your stomach. A palpable mass means you or your doctor can actually feel a firm, irregular lump in your upper abdomen. Patients with HCC may occasionally develop a paraneoplastic syndrome, a collection of symptoms caused by substances the tumor produces or by the immune system's reaction to the tumor. These can manifest with hypoglycemia, low blood sugar causing lethargy, confusion, shakiness, or sweating. Less than 5% of tumors secrete insulin-like growth factor 2, which can cause severe symptomatic hypoglycemia sometimes early in the course of the disease. Erythrocytosis means abnormally high red blood cell counts, probably due to tumor secretion of erythropoietin, though raised serum levels may be present in up to 23% of patients with HCC. Actual elevations in hemoglobin are uncommon, and most patients are anemic at diagnosis. Hypercalcemia, elevated calcium in the blood, can be present in association with bone metastases, but it may also be seen in the absence of bony metastasis due to secretion of parathyroid hormone-related protein. This causes fatigue, confusion, excessive thirst, and frequent urination. Except for erythrocytosis, these paraneoplastic features are generally associated with a poor prognosis. Now you might be wondering who exactly should be screened. Almost all adult patients with cirrhosis, and some patients with chronic hepatitis B virus, are at sufficiently high risk for developing hepatocellular carcinoma, and they should be enrolled in a surveillance program. In a trial of 19,200 Chinese patients with chronic hepatitis B virus and 5-year follow-up, the mortality rate due to HCC was lower in patients undergoing surveillance. The reduction was 37%, meaning surveillance cut the death rate from 132 per 100,000 down to 83 per 100,000. For For patients with cirrhosis of any etiology, any cause, it is estimated that up to 1/3 will develop HCC during their lifetime, with an annual incidence rate of approximately 2%. That means if you have cirrhosis, your risk of developing liver cancer is about 2 out of 100 each year. Over 50% of HCC cases worldwide were attributed to chronic hepatitis B virus and 20% to chronic hepatitis C virus infection. Patients with chronic hepatitis B virus infection are at risk for HCC, even in the absence of cirrhosis. If you have cirrhosis from any cause, alcohol, hepatitis B, hepatitis C, metabolic dysfunction-associated steatohepatitis, or any other condition, schedule a conversation with your doctor about enrolling in a surveillance program. Surveillance means abdominal ultrasound every 6 months, sometimes combined with a blood test called alpha-fetoprotein. If you have chronic hepatitis B without cirrhosis, but meet high-risk criteria, family history of HCC, male over age 40 from an endemic country, female over age 50 from an endemic country, African descent, or elevated liver enzymes with high viral load, you also need surveillance. Keep a symptom diary, noting any new abdominal pain, unexplained weight loss, feeling full quickly, or abdominal swelling. Document when symptoms started, their severity on a scale of 1 to 10, and what makes them better or worse. Given my liver condition, what is my personal risk level for developing hepatocellular carcinoma? Ask them to explain in numbers you can understand. Should I be enrolled in a surveillance program, and if so, what does that involve and how often? What symptoms should prompt me to call your office immediately, rather than waiting for my next appointment? Specifically ask about variceal bleeding signs, worsening ascites, new abdominal pain, jaundice, or confusion. If I have chronic hepatitis B or C, am I a candidate for antiviral treatment to reduce my HCC risk? What lifestyle modifications can I make to reduce my risk? This includes complete alcohol cessation if you have any liver disease, maintaining healthy weight, managing diabetes if present. Seek immediate emergency care if you experience vomiting blood or material that looks like coffee grounds, passing black, tarry stools, sudden severe abdominal pain, sudden increase in abdominal swelling over days, yellowing of your skin or eyes, jaundice, that is new or rapidly worsening, confusion or difficulty staying awake, or fever with abdominal pain. Schedule an urgent appointment within 1 week. Not emergency, but do not delay. If you notice unintentional weight loss of more than 5 pounds in 1 month, persistent upper right abdominal discomfort lasting more than 2 weeks, feeling full after eating only small amounts for more than 2 weeks, or a new lump or mass you can feel in your upper abdomen, contact your doctor at your next scheduled visit to discuss persistent fatigue that is worsening, unexplained itching, or mild ankle swelling. Let me quickly recap. Early HCC is silent, making surveillance essential for anyone with cirrhosis or high-risk chronic hepatitis B. Watch for liver decompensation signs like variceal bleeding and ascites, advanced symptoms like abdominal pain and weight loss, and rare paraneoplastic syndromes. 6-month ultrasound surveillance cuts mortality by 37% in high-risk patients. This information is for education. Always discuss your individual situation with your healthcare provider. The American Association for the Study of Liver Diseases provides comprehensive HCC guidelines at www.aasld.org, including patient-friendly resources on surveillance and management. The European Association for the Study of the Liver offers evidence-based clinical practice guidelines on hepatocellular carcinoma management at www.easl.eu. Thank you for watching this video.